So we'll now take a bit of a closer look at our overall vaccination progress to date here in Halton. Next slide, please. As of end of day on September the 12th, over 850,000 doses of COVID-19 vaccine had been administered in Halton. This includes nearly 670,000 doses administered at community and hospital-based run clinics clinics run by Halton Region Public Health, Halton Healthcare, and Joseph Brant Hospital. Nearly 24,000 doses were administered by Halton Region Public Health and paramedic mobile teams at diverse settings throughout the region, and over 160,000 doses have been provided by pharmacies and physician offices in Halton. The pace of vaccines administered has slowed considerably throughout the month of August and into September as the demand has waned and the majority of the eligible population has been fully vaccinated, with an average of less than 1,000 doses given out per day so far in September, compared to about 11,000 doses per day given out the last week of June. This level of mass vaccination would not have been possible without 9 community and hospital clinics and over 967 regional staff supporting clinic operations. As we round down some of our larger clinic operations, we are all very grateful for all the staff that stepped up to do their part. Next slide, please. As of the end of day on September the 12th, 85% of the Halton population turning 12 years of age or older this year have had at least 1 dose of the vaccine, and 80% have had 2 doses. Coverage remains lowest among the young adult population, with only 67% of the population aged 25 to 29 and 72% of the population aged 30 to 34 having received both doses. Next slide, please. Data from Public Health Ontario show that Halton is one of the public health units with the highest percentage of the population fully vaccinated. Please note that these estimates include the entire population, including our 0 to 11-year-olds who are not yet eligible to be vaccinated. This is why we see lower numbers than when we present coverage rates elsewhere, which typically only include the eligible population. Next slide, please. As we know, vaccines improve our protection from severe illness, but it is expected and normal to see a small portion of people infected with COVID-19 after they have been vaccinated. These are considered vaccine breakthrough cases if their symptom onset was 14 or more days after they received their second dose, or they test positive for COVID-19 14 or more days after their second dose. New data released by the Ontario Science Table estimates that unvaccinated people have a 6-fold higher increase of symptomatic COVID-19 disease, a 30-fold higher risk of being in the hospital, and a 48-fold higher risk of being in the ICU compared to fully vaccinated people. These numbers are evidence of what Emily, a 22-year-old with COVID-19, voluntarily shared with the Halton community in a recent video posted on our social media platforms. She reflected, and I quote, "The COVID virus doesn't care what your reason is for not getting vaccinated," end quote. Next slide, please. To date, out of the 440,000 plus residents who have been immunized with 2 doses of COVID-19 vaccine, only 0.08% were diagnosed with COVID-19 after vaccination. Severe outcomes have been very rare in vaccinated cases as expected. In the past week, only 26% of Halton's population had not yet received any dose of COVID-19 vaccine. Many of these individuals are children under the age of 12 who are not yet eligible for vaccination. However, almost 2/3 of COVID cases reported in the last week have been among individuals who are unvaccinated. This is disproportionately higher. At this point, children who are ineligible for vaccination are not the main driver of case counts locally. For the week of September the 6th to 12th, 33% or a third of our unvaccinated cases were under the age of 12, while the remaining 67% were age 12 and over and therefore eligible to be vaccinated. In other words, the minority of people who are unvaccinated in the population are now accounting for the majority of our case burden. Next slide, please. While we have made significant strides towards our vaccination goal in Halton, there is still work to be done to reach community-level protection. This summer, we began our last mile strategy to make vaccination more accessible in areas and communities where we have seen lower uptake. Based on the best available evidence, Halton Region Public Health identified 3 key priority populations for targeted interventions to boost vaccine uptake. These are newcomer and racialized communities, people in their reproductive years who may be pregnant or breastfeeding, and young adults 25 to 34 years old. There are obviously some overlaps in these 3 populations. Next slide, please. Sorry, if you could go, yes, thank you. Local data shows that newcomers to Halton, particularly refugees and recent OHIP registrants, tend to have lower vaccine coverage compared to those who were born in Canada or have lived here for many years. Some research has also shown that neighborhoods with a higher proportion of non-white and non-Indigenous residents have lower vaccine uptake. These trends have also been found in other jurisdictions. To increase vaccine uptake in this group, we engaged with our community organizations that serve newcomer and racialized individuals. We held Q&A sessions and provided organizations with toolkits, including translated COVID-19 vaccine resources. We also implemented a social media campaign with videos and images and testimonials of local residents with diverse backgrounds and experiences. Part of our strategy also involved working with community partners to identify and promote pop-up clinics, mobile clinics, and the provincial Go Vax bus in select neighborhoods to make it easier and more convenient for these communities to receive the vaccine. Having successfully reached these communities, next we plan to ensure that clinic locations offered thus far have reached neighborhoods with a higher material deprivation index. Where there are gaps, we will work with our mobile teams to reach these communities over the next month or so. Next slide, please. Data from Born Ontario show that even after pregnant women become eligible to receive the COVID-19 vaccine, which was from April the 23rd, over half of the people pregnant in April, May, and June of 2021 had not received any vaccine. Unfortunately, more recent data from after June are not yet available. There are several reasons why pregnant individuals could be vaccine hesitant. In the winter of 2021, when the vaccines were beginning to be rolled out, they were initially advised against receiving COVID-19 vaccines due to limited information on pregnant women. There was also a lot of misinformation on social media suggesting that the vaccines affect fertility or may harm a pregnancy, fueling vaccine hesitancy among individuals of reproductive age. We know COVID-19 is a real threat to pregnant individuals. They are at far greater risk of serious complications due to COVID-19 compared to the general population. Since April, many reputable organizations, including NACI and the Society of Obstetricians and Gynecologists of Canada, recommend COVID-19 vaccination for pregnant and breastfeeding individuals. To increase vaccine uptake in this group, we distributed a resource kit which included translated fact sheets to over 300 early years professionals, childcare providers, and healthcare providers, including physicians and midwives serving this population. We developed blogs on vaccination in pregnancy and breastfeeding, featuring people with lived experience whose stories would resonate with this audience. Also, a social media campaign has been developed where we created social media graphics and messages which were shared on Halton's social media platforms and with partner agencies to ensure a wide reach. In fact, the Ministry of Health has highlighted our work in this area as a shining example, and we have distributed our materials to all other public health units for possible adaptation. Next, we plan to communicate further through our Halton Parents Facebook. I encourage council members to spread the word and share our Halton Parents blog, on vaccination during pregnancy and breastfeeding with your followers to ensure credible information is being shared with this priority population. Next slide, please. As I said earlier in the presentation, the young adult population aged 25 to 34 in Halton is the age group with the lowest vaccine coverage for both first and second doses. As one of the last eligible groups for vaccination, their rate of vaccination rose steadily from mid-July until it plateaued in mid-August, like most of the population. To address this, we have created many resources and campaigns, including a workplace toolkit for employers to promote vaccination among employees, which is one way to reach this demographic. A social media campaign with animated videos of young adults sharing compelling stories for getting vaccinated, such as a story from Emily that I mentioned earlier, has been developed. As part of our social media strategy, we're also releasing a series of videos from me encouraging young adults to get vaccinated as soon as possible. We encouraged our physicians to promote vaccination and have guided conversations with this age group. Literature shows that physicians are a trusted source for this age group, and we have strategically placed ads like the one shown here on gaming platforms that young adults use. Next, we're looking at towards policy levers, such as vaccine policies, that will help this age group and other hesitant groups. Overall, for vaccine hesitancy work, we have made a lot of progress, and this is thanks to the hard work of our staff, partners, and leaders, including our local mayors and councillors. We appreciate your ongoing support to continue promoting vaccination in our community. Next slide, please. The province is currently offering third doses of the COVID-19 vaccine to those at highest risk in order to provide them with an extra layer of protection against the Delta variant. This includes individuals with some specific health conditions and residents of high-risk congregate settings, including long-term care homes, higher-risk licensed retirement homes, and First Nations elder care lodges. These individuals can now get a third dose of the COVID-19 vaccine at a Halton Region vaccination clinic, pharmacy, or participating primary care office. Individuals must present a completed referral form from their healthcare practitioner when they arrive at the clinic location. Halton Region's mobile clinics have begun offering third doses to residents of long-term care and high-risk retirement homes. The provincial government has identified the settings in Halton that meet the criteria for third dose. Not all retirement homes are eligible at this time. The Ministry of Health is closely following the research on the safety and effectiveness of a third dose. Recommendations will be re-examined on an ongoing basis as new data emerges, including for other immunocompromised groups. Recommendations will be issued as part of Ontario's ongoing COVID-19 vaccination program as further evidence becomes available. Next slide, please. So vaccination policy is an important step towards encouraging every last eligible person to get vaccinated. This is critical to protecting the province's hospital capacity while also supporting businesses with the tools they need to keep customers safe, stay open, and minimize disruptions. We will have a look at what's happening at the provincial level as well as here in Halton. Next slide, please. On August the 17th, the province issued a directive mandating COVID-19 vaccination policies for high-risk settings, including hospitals, home and community care service providers, and ambulance services for paramedics. Employees, staff, contractors, students, and volunteers working in these settings are now required to provide proof of full vaccination against COVID-19 or a medical reason for not being vaccinated, or proof of completion of a COVID-19 vaccine education session. Individuals who do not provide proof of vaccination will be required to undertake regular antigen testing. These high-risk settings are required to track and report on the implementation of their policies to the provincial government. In Halton, we're also taking proactive steps to reduce the spread of the highly transmissible Delta variant. Workplace vaccination policies are crucial in our efforts to prevent workplace outbreaks, protect workers, and our community. On August the 26th, I released recommendations for local employers to assess the need for and develop their own vaccination policies to protect their workers and the public. To support workplaces in developing vaccination policies, I issued a guidance document. This document includes information on key components to include in a vaccination policy. It is available on our web pages for all businesses and has been shared with employers and business owners through our various platforms. Lastly, all workplaces with 100 or more employees physically present in a workplace are required to establish, implement, and ensure compliance with a COVID-19 vaccination policy in accordance with my recommendations. Such a policy must be in place by September the 22nd, as per my letter of instructions from September the 8th. Next slide, please. On September the 1st, the province announced that beginning September 22nd, Ontario would require proof of vaccination to access certain businesses and settings. The approach taken focuses on higher risk indoor public settings where face coverings cannot always be worn. At this time, we anticipate an enhanced vaccine certification with QR code and accompanying verification app. This could be available by October the 22nd. A negative COVID-19 test or recent COVID-19 infection cannot replace the vaccine certification. Individuals who cannot receive the vaccine due to medical exemptions will be permitted entry with a doctor's note until recognized medical exemptions can be integrated as part of the digital vaccine certificate. Children who are 11 years of age and younger and unable to be vaccinated will also be exempted from these requirements. The regulation was released by the province yesterday. Businesses will be required to verify vaccination status of their customers and patrons entering facilities, except where exemptions apply, such as picking up or placing an order. Next slide, please. This month, we're seeing a return to in-person learning across the province and Halton region. We all have a part to play in keeping our schools safe and open. Let's have a look at some of the steps we're taking here in Halton. Next slide, please. So the first protective strategy to keeping children and staff safe and healthy is vaccination. Halton Region has offered vaccines to our youth aged 12 to 17 at our community clinics and pop-up clinics throughout the summer, in addition to appointment options at pharmacies and primary care providers. The most recent data shows that the COVID-19 vaccination rate amongst 12 to 17-year-olds in Halton who had received their first dose was 90% and 83% for those who had received 2 doses. Milton is outpacing the rest of our community with over 95% of this age group with 1 dose and 87% with 2 doses. Next slide, please. When it comes to implementing appropriate public health measures, Halton Region Public Health provides guidance that aligns with Ontario's Ministry of Health. There is not one specific measure that will prevent transmission from occurring in schools, but a combination of strategies that contribute to making schools healthier places to work and learn. Daily screening, masking, and physical distancing are examples of protective strategies schools are expected to implement. Public health encourages as much distance as possible between students and staff, and between staff members. Physical distancing measures are then to be layered with other public health measures such as hand hygiene, cohorting, and enhanced cleaning. The more measures we put in place, the lower the risk will be. These measures will help keep our schools open for longer. Although the Ministry of Education encourages kindergarten students to wear a mask indoors, given the rise of the Delta variant and that this group of children are not currently eligible for vaccination, Halton Region Public Health has recommended masking for JK and SK students. Our public school boards have implemented this recommendation through their own policies. Students do not need to wear masks outdoors, but distancing should be encouraged outdoors as much as possible, especially between different cohorts. Masks may be temporarily removed indoors for eating and drinking at lunch or break times. All staff and visitors in schools must wear medical masks and should use eye protection, such as face shields or goggles, when working with children who are unable to wear masks consistently and correctly, or when close contact is required, such as in a kindergarten class. As always, Reasonable exceptions for wearing masks due to medical conditions will apply for both staff and students. Next slide, please. Public Health has been working together with Halton school boards every step of the way through the 2021-2022 school year planning process to ensure we are balancing the learning needs of our students, their physical and mental health, and the safety measures required to reduce the chances of COVID-19 entering and circulating in our schools. On August the 25th and 26th, the Halton Region Catholic School Board and Halton Region District School Board hosted 2 live webinars and Q&As with me. During these webinars, families had the opportunity to submit questions about school reopening and have their concerns addressed. On September the 7th, a similar webinar was hosted for childcare settings. Associate Medical Officer of Health, Dr. Deepika Lobo, presented and answered questions at this webinar. We also continue to host regular physician town halls with our local physicians. The last one at the end of August provided local physicians with information on our school and childcare guidance that was relevant for them in their care of school-aged children and youth. Next slide, please. On August 17th, we learned that the province had paused our exit from the roadmap to reopen based on rising case counts, largely amongst unvaccinated individuals. Health Canada had originally suggested that when 75% of all eligible people are fully vaccinated, personal measures like physical distancing and wearing masks could begin to loosen. However, the presence of new variants like Delta means that we will have to be more cautious and continue to follow public health measures until at least 90% of the eligible population is vaccinated. Our vaccination rates are climbing, and we are seeing vaccination policies being implemented across a variety of industries and organizations. We will have to keep moving forward with our efforts and continue to do our part to keep COVID-19 case counts low and protect our most vulnerable. Next slide, please. And with that, I thank you for your time and attention today.